So my case study is going to be on the ACL and meniscus surgery and rehab. I'm going to go over the injury itself, what the mechanism is, as we go right here. Discuss the two surgeries. We're going to go over the mechanisms that cause the injuries, and then we are going to discuss the case study briefly on my patient, just let you know where they're at. And all that other good stuff. And then we're going to discuss the rehabilitation process for both surgeries. So as you'll see at the end of this slide after this presentation, that both of the surgeries, both are very similar, very different injuries obviously, but very similar in the rehab process and the what the steps we're going to take to get this patient back to play. So let's begin. So we have the ACL injury. It's a tear at the anterior cruciate ligament, as you can see. Sorry about that. It's a really common injury. A lot of athletes. It's caused by a sudden stop, twist, or change of direction. Obviously, a lot of athletes do that while they're in a game, at practice, just getting ready to play. The patient will definitely feel a pop, or feel or hear a pop in their knee. So my athlete, she was running full court sprints and got a pass thrown behind her. So she had to stop suddenly, twist, and change back direction. She heard the pop, so she knew what type of injury it was already. And so she knew right away that nothing was right. It wasn't right, and she definitely had the ACL injury. You can't weight bear on the leg on this injury. I've seen a lot of athletes do it. They kept on playing. It's not good for them. It's not good for their body. So if you definitely see an athlete struggling out there holding their knee, if they can't bear weight on it very well, then definitely get them off the sidelines, get them off that knee, and definitely get into a physician, see if it's torn, strained, or sprained for sure. And then the return back to play for this is 10 to 12 months. So this one takes a little bit longer, especially in athletes, because a lot of pressure goes on their knees, so they have to have those ligaments as fully 100% back to health than normal non-athletes. They're usually not going to be putting as much stress on that knee joint, so they're definitely not going to have a longer rehab process. But it also depends on age, sex, obviously occupation, and all that stuff. So now let's go to the meniscus. So the meniscus injury is a tear at the meniscus cartilage. The meniscus is like a C-shaped cartilage that is a shock absorber. It's going to help the femur and shin bones from rubbing up against each other, causing a very difficult pain in that knee for sure. It's the most common knee injury. When they says common, it's just because a lot of athletes get a direct blow to the knee, so that means the meniscus is probably going to be torn. Very, very common in a lot of sports, even in non-sports. You could get a meniscus injury just as easily as you would be in a sport, obviously. Non-weight bearing as the ACL. You don't want to put any weight on it, especially with that cartilage is torn. You're going to have bone rubbing on bone. It's not going to be ideal for the athlete. So if you see them can't put weight on their knee, definitely get out there, help them off the field, make sure they don't put any weight on that knee, keep their leg extended so that the bones won't rub it against each other and make it a little bit more difficult for that meniscus tear to be identified. The return to play for this is 3 to 6 months, so it's a little bit shorter than the ACL, but it's definitely going to be the same process in the rehabilitation just as well. We'll get to that in a minute. Right now, we are going to look at the case study, my case study patient. So she's a 21-year-old female. She's a basketball player. She is interestingly from Bulgaria, so she moved to Texas about 3 years ago. Started playing basketball. Injured her. Have has had injuries in her left knee the past year and a half, and then last year she got a her ACL and meniscus surgery on her right knee. So this is the first surgery on her right knee. She also had a grade one MCL sprain. Wasn't too bad. Grade one's not that bad. So she was able to rest it up while she had the surgeries on both her ACL and meniscus. So that wasn't much of a problem for her. Obviously, her return to play was 10 to 12 months just because of both those surgeries. Right now, she is at the 6 month mark of her rehab, so that's a good thing. She's doing really well. With this surgery, with both these surgeries happening, she had to do the ACL surgery first to get that repaired. It takes longer, obviously, to rehab that, so she had to get that repaired. And then a month later, she had her meniscus surgery. Second, why they had the meniscus surgery second is because it's a shorter time, and the rehab process for both of them are fairly similar, so they're both going to get rehabbed at the same time. ACL is obviously going to take a little bit longer, but they both will get recovered at the same time. Let's see. So, like I said before, her progression, she's at 6 months into rehab. She's jogging with light sprints at the end. She is a basketball player, so she does do full court jogs, sprints, not full sprints. She probably does about 3/4 sprints from on the court, so that's a good thing. Just to keep that range of motion still intact, but also just not to push it as hard as she is, especially at that 6 month period. We don't know where she's going to be at in the next couple months, so we'll see. We'll see about that. She did get full range of motion back into her knee joint, so that's a good thing. Lets her do weightlifting, get her jogging and running in. Her gait cycle, her walking obviously is better now too, so that's a good thing. And then plyometrics is instituted, so they allowed this plyometrics, which is the jumping, running, all this stuff, to help her get more comfortable with those again, but also getting that range of motion back into those knees, into the knee and to the joint. So this will also help her out. All right, the next thing we're going to be going over is the ACL rehab. So this is from the Emory Health Board. They only had the ACL surgery 4 to 6 months, I think, is what I saw. Obviously, it's going to be a little bit varied just because of an athlete, a person, a patient. So that's definitely one thing to look at. Phase 1, first 2 weeks of surgery, control inflammation, obviously, range of motion being regained, quad control, crutches are needed, definitely bracing as well, and then the patella mobilization has to be limited just so we could keep those tendons together, strong, healed properly before we actually start moving that patella. Phase 2 is going to be lightweight lifting, like I said. Full range of motion should be complete and improved in endurance and proprioception. So at this stage, she should be able to get on some machines, treadmill, elliptical, step up machine, just to get that proprioception back into that knee joint, endurance as well, just so the muscles can not get atrophied. The third phase is progression in power, strength, and proprioception. This is very important because this is going to be very close to almost return to play, so they want to get all that strength back into that joint, power, proprioception as well. Jogging is going to be implemented with some light sprinting, so this is at her process where she is light sprinting, doing more jogging, light workouts, a lot more plyometric stuff as well. And then the fourth phase, this is going to be going back to return to play. Patient meets all the criteria. No complaints of soft tissue damage or range of motion. That's a very important one. You don't want any soft tissue damage or no range of motion just not being there, because that means inflammation might start up again, and you would have to restart that whole process if that is a problem. Educate the patient in possible limitations. The examiner should not have any limitations for the athlete if they've been through the whole rehabilitation process. But if they do, then that means there might be just something with the patient that is still very concerning. They might want to still wear a brace for a couple more weeks just to make sure that is good. But it's also just very nice to let the patient know what they went through and how it's going to be after. And then obviously the patient has to maintain strength, power, and proprioception throughout all the tests that they do to return to play. Sweet. And then now we have the meniscus rehab. The meniscus rehab, fairly similar to the ACL. They're gonna have almost the exact same exercises, same phases. This one maybe a little bit, obviously a little bit shorter, a little bit more different. Definitely want to get the range of motion back into the knee. Definitely want to build up the strength and endurance in that cartilage, just because there's so much pressure going into that cartilage that they need to have it strengthened. So we'll go with the phase one right now. I'm getting a little off track, but so phase one, obviously after 2 weeks after post surgery, they're gonna reduce swelling, infection, all that stuff, regain full range of motion, control pain, complications, and passive range of motion up to about 90 degrees. So that's a pretty good sign. Phase two, prevent any complications, obviously, with gentle protected motion. So this is when the examiner will be doing assisted range of motions, getting it back to a normal feel. If the patient doesn't feel comfortable, obviously, definitely gonna keep on working on that. Reduce swelling and inflammation, just like in the first phase. You always want to keep that down within the first month, at least. Well, actually, not even first month, first 4 weeks of the surgery, so a month, yeah. Definitely want to regain quad control, just like in the ACL. It's going to be very important going down the road. Level ground ambulation with minimal mistakes by week 6. So ambulation is basically the gait cycle, walking correctly. All the stages are completed with very minimal mistakes, obviously, by the week 6. So getting them back to walking in a straight line, getting all the stages correct in that gait cycle. Phase 3 is range of motion is almost back to full motion. So this is the meniscus. Obviously, it's going to take time to get that range of motion back, but once you do, everything else will follow up after that. Definitely want to improve the muscular strength and endurance in that joint, in that capsule as well. Control forces on extensor mechanisms. Obviously, the knee is an extensor, it's a flexor, but it's more of an extensor. It doesn't extend that much, but it helps with a lot of stuff. So you definitely want to control those forces. Normal gait cycle is coming up, and then a single leg static balance with proper proximal control. This is more of like a proprioception, plyometrics, it's more like proprioception for sure. It just gives that balance back into that knee joint on that single leg, gets balance back into the feet, just build up that muscle around that knee again, and just helps out with the process after down the road with balance control and all that good stuff. Okay, so phase 4, pain-free range of motion in the joint, pain-free ADLs as well. So no pain in when they move it themselves, when it's assisted in moving as well. Also in ADLs, which is everyday, all-day living situation. So everyday activities of daily living. My bad. So ADLs are activities of daily living. So like walking, sitting down, just all those simple things that you do in the day that you take for granted. We do want to control those, make those pain-free, and also just get them back to a regular routine as well. Definitely gotta get that quad strength. It's improved as well. It should be almost at 100%. It's about 85 right now in this fourth phase. The gluteal strength as well, so you don't really think about the gluteus maximus or minimus to help out with anything, but it does help out with walking, especially in the knee. You don't really think so, but there's a lot of ligaments pulling in that hamstring that will help out with the knee, especially with walking, jogging, running, all that stuff. The step up, single step up, and all that. And then improved single leg proprioception, like I said before. This will just help with the balance for the knee, but also just for the whole body. And then the phase 5, this is going to be return back to play. They pass all the tests to return back to play. No complaints of pain or instability while doing sports-specific exercises, so that's a good thing. And then functional assessment is cleared, so all the functional assessments for the knee and that meniscus is all cleared. They have all range of motion back, manual muscle tests, all the ligaments, all the laxity, everything is perfect, and that means they could come back to work, back to play. My patient, she's at her 6 months, like I just said, so she's about 4 to 6 months left in her rehab. This is more towards her ACL than it is her meniscus, but obviously they work together in the knee, so they're definitely going to have the same timeline to be done with the rehab. But she's doing great. She's hopeful to get back sooner than later. One setback that she did have that she was really upset about was she's actually retiring from basketball. She doesn't want to have to go through another injury, and which I totally understand. It takes a lot out of the body, and physically and mentally. It takes you out. You don't know how long that surgery's how long that injury's gonna take to rehab, if it's going to come back 100%. So she's definitely focusing more on her mental health than anything, which I definitely totally agree with her too. If she wants to do that, I'm 100% behind her back. She's following all these protocols definitely almost to the T. The trainer out that she has, he's definitely doing a great job. She's almost to a point where she's going to be starting doing heavy lifting and starting to sprint more than just jogging. So that's a good thing. And yeah, so I'm hoping she doesn't quit her career as long as she wants to, but we'll see. These will be my references right here. And yeah, thank you for enjoying this, and hope you guys enjoyed it. Thank you so much.